When we talk about heavy metals, let's start with how do they even enter the body? Because I know that there are many different ways, and it's kind of crazy that we fabricated a world in which we actually introduce heavy metals willingly into the body. I'd love for you to go into some of those, but what are some of the most common culprits of heavy metals entering the body?
Yeah, so there's a lot. Some of the key players or major ones that we see at the clinic, I'll just go off of that, or when you do any type of testing like doctor's data, ZRT, things like that. Mercury, aluminum, arsenic, lead, cadmium, thallium. There's probably 10 other ones that you could find, but those are the ones that we generally see that cause the most issue and problem within the body. So for instance, a lot of our patients at our clinic, they're more of the adult age. The top one that we see in 80% or more of people is mercury. So when mercury, think fish, which yes, it's in fish, especially nowadays because the quality of food has gone down immensely, which is a whole nother topic, but it's in fish. But a big one too that people I think are catching on to a lot more nowadays is amalgam fillings. So a lot of our patients have amalgams or they've had them removed improperly or didn't do a proper detoxification afterwards. And if you've ever seen that study from University of Calgary where they take that little pencil eraser, they gently touch that amalgam filling, the amount of mercury vapor that is emitted is quite gross. And where do your teeth sit? They sit right below your brain, your central nervous system. So all of that vapor, when you eat, when you swallow, when you're brushing your teeth, when your tongue is gently touching that tooth or teeth, it goes into the tissue in your brain and kind of just gets lodged there. And if you don't have proper circulation detoxification, which a lot of people nowadays do not, that can present itself in a slew of ways like really bad brain fog, issues with cognition, insomnia, headaches, sometimes to the point of degeneration of Alzheimer's dementia if you've had it in your mouth for 20, 30, 40 years. It's in other things too, like preservatives and medications, antifungals for wood and things like that too, but definitely one of the more common things that we see. And then the second highest that we see is aluminum and lead. Lead is something that I think a lot of people are a little bit more familiar with back in the day when kids were exposed to lead paint. They were eating paint chips and adults had it in their blood. Not so much the case anymore. It is still a little bit common in that way, but the number one way that you see patients exposed to it is actually water. You're in the city right now, Casper. A lot of those buildings are very, very old. The piping is not up to par. So that's a really easy way that water can get contaminated. And then for females, cosmetics, lipstick is like the number one. I know you don't wear lipstick, but I do. It's the number one culprit in terms of lead toxicity in that industry. But water is probably the number one for lead. And then aluminum. Aluminum is in, people don't know this, home decor, furniture, deodorant. That's, yes, exactly. Pots, pans, cooking utensils. And recently over the past year-ish, we've been seeing it in a lot of our patients because it's a preservative in vaccines. So, it's just naming off those three. I'm sure anyone listening is probably like, oh my goodness, I use that. I do that. I live here. That's just a few. And then there's the third most common is probably arsenic. Arsenic, I think, kind of rings a bell for some of us mommies who use baby food. Or if you do use baby food, that was kind of a big to-do that happened a couple of months ago. I believe it was Gerber found it in a lot of their baby foods because it is in rice cake, cereal, some vegetables, but also it's used in herbicides, pesticides, anything with the word "ide" at the end of it, really. So you're spraying all of our food and crops with that, and then you're ingesting it. So again, not to scare people, but just to kind of give you an idea or insight. Oh my goodness, this is literally everywhere. Like we kind of do live in a way more toxic environment than we realize. And, that's not even touching on industrial/domestic cleaning products. That's just to name a few, rattle off a few.
Yeah, it's absolutely insane how many things out there are toxic to us and how many things we're using every single day. I remember speaking to my father about, it's like heavy metals have a place. They are naturally occurring substances. They have a place, but they should be in the earth, not in our bodies. In our bodies, they wreak havoc. Right. And, if you've ever learned about mercury poisoning, that's a huge neurological issue that it affects the brain. Right. It affects so many other areas. And sometimes you do look at that correlation of what is autism like and what does mercury poisoning look like? Kind of the same thing. And it makes you wonder a little bit. I'm not saying there is a direct correlation, but there is something to look at there when we look at so many things that are toxic, especially heavy metals that we introduce willingly into our bodies.